Today, we're going to dive into a really specific and really important topic in pediatric medicine. It's a rare one, for sure. But for the families it affects, understanding it is absolutely everything. We're going to break down what hepatoblastoma is, who gets it, and the incredible hope that modern treatments offer. So, to kick things off, I've got a question for you.
Just let that sink in for a moment. You know, when we think about liver cancer in adults, we often connect it to things like lifestyle or certain viruses. But in kids, the story is completely different. And the answer to this question, well, it's what this entire explainer is all about.
And there's our answer, hepatoblastoma. It's a name you've probably never heard before, but in the world of pediatric oncology, it is a huge deal. Put simply, it's a cancerous tumor that actually starts in the liver cells of very, very young children.
And that's why this is so important. Even though hepatoblastoma is rare in the grand scheme of things, if a young child has a tumor that starts in the liver, this is the most likely culprit. That makes understanding it absolutely critical for doctors and specialists.
So who are we talking about here? Who are the patients? To really get a handle on this disease, we first need to look at the typical profile of a child who's diagnosed with it.
This right here is probably the most striking fact of all. The median age is just 18 months. Yeah, we are talking about toddlers. In fact, pretty much all cases happen before a child turns 3. This isn't a disease that affects older kids. It hits the very youngest among us.
And a few other things help round out the picture. It shows up a little more often in boys. And this is a really key point. Most cases are sporadic. That means they just happen by chance. They're not inherited. Now, in some rare instances, there's a link to certain genetic syndromes. But unlike so many adult liver cancers, there's no connection at all to viral hepatitis or other liver problems like cirrhosis.
Okay, so how do people even find it? This is a huge piece of the puzzle. The most common sign is a lump in the child's belly that doesn't cause any pain. There are no other symptoms. It's often discovered completely by accident, maybe by a parent during bath time or by a doctor during a routine checkup. As you can imagine, that can be a real shock.
So once a doctor suspects a mess, they start looking for clues in the blood. And a huge one is something called alpha-fetoprotein, or AFP. See, this is a protein that's normally made when a baby is developing, but the levels drop right after birth. Well, in 85 to 90% of these cases, the tumor cells start pumping out high levels of it again. This makes AFP an amazing marker, not just for figuring out what's going on, but for tracking how well the treatment is working down the line.
So we have the symptoms, we have the blood markers, but how do doctors get to a final, definitive answer? Let's walk through the steps of that diagnostic journey.
It's a really clear, methodical process. It all starts with an imaging scan, usually a CT scan. That scan will show a mass in the liver with a lot of blood vessels feeding it. And here's a cool little detail doctors look for. In about half of all cases, the tumor is speckled with tiny bits of calcium, called calcification. But to be 100% sure, the final step is always a biopsy. That's where they take a tiny piece of the tumor and look at it under a microscope. That's what gives the final answer.
You know, hearing the word cancer in the same sentence as child is terrifying. There's no way around that. But this is where the story really takes a turn toward hope. The progress that's been made in treating hepatoblastoma is just remarkable. So what's next for these little patients?
The standard of care is this really powerful 1-2 punch. Surgery to get the tumor out, and chemotherapy to hunt down any cancer cells that might be left behind. And that aggressive strategy stays the same even if the cancer has spread, which it most often does to the lungs. Even then, doctors will go in, remove the liver tumor, give chemo, and then, if they need to, they'll even go in and surgically remove the spots in the lungs.
And this is the most important one you'll see today. Even for patients where the cancer has already spread to their lungs, modern treatment can achieve a cure in about half of those cases, 50%. That's just an incredible testament to how effective these therapies are, and it offers so much hope.
Okay, we have covered a ton of ground in a really short time, so let's just take a second and boil it all down to the absolute essential things you should walk away with.
All right, let's run through it. 1. It is a #1 liver tumor in toddlers. 2. It usually shows up as a painless lump in the belly. 3. That AFP blood test is a super important marker. 4. A biopsy after a scan is what confirms the diagnosis. 5. Treatment is that aggressive combo of surgery and chemo. And number 6, the most important one, there is a very real and very significant chance of a cure.